Officials across the country believe the rise in respiratory syncytial virus infections in young children across the country is caused in part by people not adhering to COVID-19-like precautions.
Shatanya Clark has this story for us. She joins us now. So, Shatanya, are local health officials seeing a rise in cases here?
That's right, Daryl. Since providers are not required to report this virus, it is hard to say, especially in a general sense. But one doctor we spoke with says he has seen an increase in his patients.
We don't know what to expect going into this next winter.
Health experts across the country say there has been an unusual increase in respiratory syncytial virus infections in young children. And epidemiology nurse Brandy Smith says this is also the same for the Lone Star State.
Mostly because of likelihood of the public health measures have decreased. We've kind of gotten a little bit lax with our COVID precautions.
RSV is a respiratory virus that usually causes mild cold-like symptoms, typically affecting young children under the age of 1 and older adults over the age of 65. It is spread the same way as the coronavirus, through respiratory droplets. Smith says RSV is not a reportable condition, therefore it is unclear how many cases the county has seen. But Dr. Jake Kaiser of Pediatric Associates says the area is following the trends of everywhere else.
We have seen a lot of RSV cases and cases of bronchiolitis, which is the disease process that RSV causes. We've seen a big increase unseasonably here in the late spring and summertime.
Kaiser and Smith say typically there is a spike in the cold winter months, so it is odd to be seeing an increase now. So what should parents be looking for?
You need to watch for the labored breathing is the thing. Usually a few days into the illness, babies might start having difficulty breathing where they are sucking in deeper, using all their muscles to get air in. So really you need to look at what the chest is doing.
Kaiser says if you notice your baby breathing very fast and very hard, they need to be evaluated by a doctor right away. He adds, while the vast majority of babies with the virus will be fine and can be treated at home, if not treated, RSV can cause death.
On the average, there's about 58,000 hospitalizations each year, and that's in the United States, for kiddos with RSV. And then there's anywhere from 100 to 500 deaths per year among children, which is a lot.
Smith and Kaiser say the main thing in preventing RSV is to be safe. Wash your hands, keep your baby away from sick people, cover your sneeze, and always sanitize.
While it can be difficult to detect RSV because it mimics the symptoms of the common cold, there are some things health officials say you want to look out for in your babies that are runny nose, cough, wheezing. They may or may not have a fever, decreased appetite, or poor feeding habits, which could cause dehydration.
Thanks so much for all that information for parents to really look out for this and stay on top
RSV can be
of
so
it.
scary.
Yes, absolutely.
Oh boy.
Okay, Shatanya, thank you.